Hello, my name is Dr. Miriam Krause, and today I would like to talk about PCOS, or polycystic ovary syndrome. PCOS is the most common hormonal abnormality in young and otherwise healthy women. Originally, PCOS was described back in the 1930s on a series of women who had really large ovaries, who had no periods, and also noted hair growth in their face and on their chest and arms. Since then, we've learned a lot about PCOS, and we now know that there's a lot of different phenotypes, meaning that some women are overweight, some women are normal weight. Most women, however, have irregular cycles, and a lot of women also complain about hair growth. We don't really understand completely how PCOS happens, but we believe that it is a result of a miscommunication between the brain and the ovaries. The ovaries produce too much male hormones or androgens, and high insulin levels also seem to play a role. Before we can make the diagnosis of PCOS, it is important to rule out other conditions that can look the same but that are actually treated differently, such as thyroid abnormalities or high prolactin levels or ovarian failure. So to make the diagnosis, your doctor will check some lab work, do an ultrasound, and obviously get a really good history and physical exam on you. Now, there are two major issues with PCOS. One is short-term problems and the other one is long-term problems. The short-term problems mainly involve irregular bleeding, heavy periods, and if a woman does want to get pregnant, it may be harder for that because there's no ovulation or less ovulation, less frequently. The other long-term problem is more the risk of developing diabetes, cardiovascular abnormalities, and also endometrial cancer. So the treatment overall depends on what the priority is. If the priority is to regulate cycles and the patient does not want to get pregnant, the easiest way is usually to start the patient on hormonal birth control, such as pills, patches, the vaginal ring, or cyclic progestins. However, if the patient wants to get pregnant, then the best option usually is to start her on a pill called clomiphene or letrozole, and that will help to make the ovaries ovulate more regularly. For both of those priorities, in women who are overweight, losing some weight, approximately 10% of their current body weight, can actually reset the miscommunication between the brain and the ovaries and potentially lead to regular cycles and easier way for conceiving. If you have any questions about PCOS, then please ask us and we can help you figure out what's going on.